Hello, my name is Kira Gurin and this is my medical emergency and I chose the cardiac arrest. What is a cardiac arrest? Cardiac arrest is also known as a sudden cardiac arrest is when heart stop beating suddenly. The lack of blood flow to the brain and other organ can cause a person to lose consciousness, become disabled or die if not treated immediately. Sign and symptoms casually is non-conscious and no breathing, no pulse. Describe the in-flight first aid protocols and procedures. Procedures is open air access for breathing for 10 seconds. Look, listen, feel. Give two breath using CPR mask if casualty is not breathing. Check for sign and regulation for 10 seconds. Palm casual movements. Adult CPR 8 years of age and older give 30 compression and followed by two ventilation continue until AED is attached to casualty or recover occur. Treat for shock. Child CPR 1 to 8 years of age give 30 compression followed by the two ventilation continue until recover occur. Treat for shock. Infant CPR under 1 year give 30 compression followed by ventilation. Continue until recover occur. Treat for shock. Protocols. Flight attendants should follow the Transport Canada regulation about fasten seatbelt. When flight attendant is giving a first aid treatment or CPR, they will have to stop and only resume care once the aircraft has landed safely and the fasten seatbelt sign has been switched off. Flight attendants should use protection such as hand washing, medical grade non-legs gloves. During a CPR, use a restriction mask. Sharp objects should be handled while wearing a gloves and biohazard universal precaution kit. Describe and explain how you will react and address the medical emergency. When you're in a situation, you should be professional and calm to make the other passenger feel safe and proceed with the CPR. Flight attendant responsibilities is to provide first aid following emergency scenes management, advise the captain of the situation and the passenger status. Follow the medical assistant if the condition warrants. Use all resources available including StanMD, MedLink. Continue monitoring the passenger throughout the treatment proven effective. And lastly, complete all documentation. Describe and explain the medical resources and equipment available to you on board the aircraft as a per the FAM and how you will use them to assist the passenger with the medical condition. Medical resources equipment is we have two parts. The first one is the first aid kit and the medical and this is the medical kit which is the emergency kit, emergency medical kit. All aircraft are equipped with emergency kit also known as M EMK or doctor or physical kit. This kit contains life-saving equipment and medication and it's a mandatory piece of emergency equipment on board the aircraft. If required in a medical emergency, the kit should be unsealed, unlocked, and offered to a certified medical professional on board. The kit may be used by certified medical doctors, registered nurse, or medical or emergency medical technician. Operation. Operation is advised the in charge who will advise the captain of the medical situation. An Ask for an onboard medical volunteer. Contact MedLink, StandMD, even if there is a medical volunteer on the board. Ask for valid identification before opening the kit. The identification of the volunteer needs to be validated for purpose of liability if required in the future. Open keep. Assisting passenger. When assisting passenger is with a medical condition, a flight attendant must receive a casualty before they can begin to assist. The flight attendant can simply ask the person if they would like to assist, or in case of a minor, ask the parents or guardian. If is permissible to help the child. If the person is unconscious, then consent is implied and the flight attendant may begin treatment. Advise the captain, advise the in charge, advise stand MD meddling page of the medical help. Thank you for listening and thank you for your taking time. Thank you.